Shrutakirty Parida, Dr. Shrutakirty. She will present BBSOS, a rare case report and literature review.
A very good afternoon to one and all. Today I will be presenting a rare case of Boonstra Schaaf optic atrophy syndrome, a rare case report and literature review. I have no financial interest to disclose. So coming to the introduction, BBOS is a rare disorder that presents in early childhood with the key features of intellectual disability, developmental delay and visual impairment. It was first reported in 2014 in 6 patients with a worldwide prevalence of 1 in 1 lakh to 2.5 lakhs. Most commonly, it is inherited as an autosomal dominant disorder, but few cases have been reported to be inherited mitochondrially. It can be either a congenital or an acquired disorder. The underlying genetic abnormality has been reported to be a heterogeneous mutation in the NR2F1 or COF-TF1 gene, which disrupts the normal neurodevelopmental process because this gene is the key transcriptional regulator of brain development. Coming to the case proper, a 6-year-old male child complained of gradually painless diminution of vision in both eyes since the last 2 to 3 years. His birth and postnatal history was eventful. He was delivered by preterm delivery by C-section at 8 months with a low birth weight. There was delayed birth cry with a history of 2 weeks of NICU stay. There was history of delayed developmental milestones with global developmental delay. On examination, his best corrected visual acuity was 6/60 and he had a abnormal head posture of 25 degrees of right face turn with both eyes moderate amplitude and frequency horizontal jerk in nystagmus with null point in the left case. Rest of the anterior segment examination was normal except for the pupils were sluggishly reacting. On the strabismus workup we found he had a 25 prism diopter of exotropia for distance and near with a -1 adduction limitation. Then we did a humanoid refraction for the child and he was having compound myopic astigmatism. Glasses were prescribed for the child and then we did a dilated fundus examination which showed a gross temporal pallor in both the eyes. Then we ordered MRI brain and orbit with contrast for the child which showed mild thinning of bilateral optic nerve with prominent bilateral perioptic space which was consistent with the partial optic atrophy. No optic nerve hyperintensities of enhancement was shown. Then we did other investigations and then whole genome sequencing was done which was suggestive of heterogeneous deletion in the NR2F1 gene. Pediatric consultation was done to confirm the systemic diagnosis. So with all this, a final diagnosis of Boonstra Schaaf optic atrophy syndrome was done. Coming to the literature review, various cases have been published on the expanding clinical phenotype of BBOS syndrome and till date literature reports 200 cases of BBOS with various phenotypical and genotypical variability. The important systemic features include developmental delay, speech delay, intellectual disability, seizures, hypotonia, hearing impairment, repetitive behavior, autism spectrum disorder, dysmorphic facial features and oromotor dysfunction. Whereas the important ocular features include optic atrophy, optic nerve hypoplasia, cortical visual impairment, nystagmus, amblyopia and significant refractive errors. The neuroimaging findings most important are the thinning of the corpus callosum, widening of posterior horn of lateral ventricle and abnormal development of the hippocampal commissure and thalamocortical projections. So the management is mostly supportive. Recommended therapies include visual therapy which is focused on CVI, physical therapy to improve the gross motor skills, occupational therapy, speech therapy, then behavioral therapy if the autism spectrum disorder is diagnosed and if the patient has seizures then anticonvulsive treatment has to be given. So the take clinic message from this presentation is BBSOS is a neurodevelopmental disorder with greater phenotypic and genotypic variability. A thorough understanding of the clinical entity is a must. The clinical description in combination with experimental research and genetic analysis will allow for a better comprehension of this rare syndrome. And one of the key questions which we need to address is to what degree BBSOS is due to altered neurodevelopmental versus neuronal homeostasis. Thank you.
So was I audible without microphone? Thank you again. So anything else you want to discuss, sir? Very nicely documented and this is a very rare case as we know.
Actually, one important rare thing we found that like these patients they have a very love for music and they have a high pain threshold.
Okay.
So when the injections was given for the contrast also MRI, the child didn't complain of any pain. Though the child was a 6-year-old child, he didn't have any complaint of pain like other children.
What was the visual acuity? I forgot.
BCV was 6 by 60.
6 by 60.
Uncorrected was 3 by 60.
For how long time you are following the child?
The child is still under follow-up. He is having vision therapy with us and also physiotherapy he is having in our hospital. So he is still under our follow-up. He is wearing glasses with good compliance and he is under our follow-up.
Thank you.